Hi, welcome to our special episode of the Secret Men's Business podcast. On today's show, we're going to be looking at World AIDS Day. Hi, this is Joey Buzzertil, and welcome to the Secret Men's Business podcast. On today's show, we're going to be speaking to Lance Schema, who is going to be talking to us all the way from Queensland about his role in the LGBTQI community work and in regards to World AIDS Day. Lance, how are you?
I'm great. Thank you. Thank you for having me.
Thank you for being on the show. I mean, I feel like these podcasts are becoming catch-ups because we've known each other for a while and I'm catching up with all these great people through the show. So I guess before we start, Lance, do you want to just tell the audience a little bit about you?
Yeah, sure. So I am an American expat living here in beautiful Queensland, Australia. I moved here in 2003 and would have met you not long after that. We had a mutual, my partner at the time was a good friend of yours, and so we've known each other a long time.
Yeah.
And I guess so my career really in Australia has been really focused in the HIV and LGBTI sexual health framework. Many years at the AIDS Council of New South Wales, known as ACON, and now I am the state manager for client services at what used to be called the Queensland AIDS Council, but is now called the Queensland Council for LGBTI Health. And I mention that in particular because we've come such a long way with HIV and particularly AIDS. And you won't hear me mention AIDS much, and that's not because AIDS is not an issue around the world, because it actually is. It's a predominant issue in Africa, Russia, China. It's not an issue any longer in Australia. There hasn't been an AIDS death in Australia for nearly, over a decade. Sorry, there's a little fly running around. Maybe a little bit longer than that. So, and that's because we have access to treatment and things. And the reason I'm saying that in the term of what I've done in the past in the AIDS councils is there really aren't very many AIDS councils left in Australia. They've all moved into this broader LGBTI health framework, and that's because we've made a lot of progress. We no longer have to focus just on a disease modality. When we talk about our communities, we can look at a much broader health, a holistic health component, of which absolutely HIV and AIDS is still a main factor, but not the factor.
Yeah. So then with that in mind, because actually you made me realize that in Melbourne now it's Thorn Harbour Health. So we've lost ours as well, or changed names. So what does then, being that World AIDS Day is tomorrow, what does it now mean? Like what is the reason why we buy the ribbons and we sell? What do we do on that day now that's different?
Yeah. Well, look, it'd be really remiss of me not to say that for probably about 25% of people living in Australia with HIV, they struggle, and just because the other 75% don't, and when I say don't, I do that in quotes because of course they do at different times, maybe when they're changing treatment, when they're still having that discussion about their status with a partner who goes, what, you have AIDS? No, I have HIV, and actually it's untransmissible now because I'm on really effective treatment. That still happens. But for about 25%, we know the statistics tell us that those people still struggle. They struggle health, they struggle with
financially.
community. Yeah. And so when we think of HIV, when we think of World AIDS Day in an Australian context, I think of those people. I also think that no one who's a part of what I call the body positive is well if any other part of that body is not well.
Yeah.
And we talk about Africa, we talk about Russia, China, Southeast Asia, which is right at our doorstep. We are not talking about a disease that is under control and being well managed. We're talking about predominantly a heterosexual disease that is very much into all of those other communities that we've been able to keep it out of in Australia, which I talk about sex worker communities, injecting drug use communities, and heterosexual populations. So I also say we're looking and acknowledging them. And then lastly, but probably most importantly, we're paying our respects to those that we lost.
Yeah, I was going to say that. Is there a retrospect where we remember? And you brought that up. Yeah. So how has PrEP changed the landscape when it comes to HIV?
Oh my gosh, that's like saying how has Trump affected America? You know what I mean? Massive, it has been a game changer. And I won't just say PrEP. I'm going to say PrEP an effective treatment for HIV. So PrEP is something that, of course, can keep you from getting HIV. So it's something that higher risk. So a lot of gay men will take PrEP daily as a prophylactic. It's actually more effective than a condom. Condoms break, pills don't. And it means that they cannot contract the disease as long as they're taking this medication on a daily basis. The same holds true for effective HIV treatment for those of us living with HIV. If we manage our viral load and we remain undetectable, we are also unable to transmit the disease. So when they talk about ending HIV and campaigns like that, effectively we have what we need to do that. No one new will get it. So it will, in a very crass way, die off with those of us who do. And if no one new gets it, that's the end of HIV. And we have the power to do that now. The problem is access. Not everyone has access to these medications. Not everyone can afford the medication. So we have the capability of doing it. We have the technology. We have the medical interventions needed. What we don't have is equal access to the medications that will allow it to happen.
And because this podcast is a men's podcast predominantly, I mean, and sorry if I sound naive, but I always wonder, why is it that all the information that you just gave me isn't really available or accessible to the straight community? I mean, it could be, but I just don't see it. Like, is there a reason why?
Still a predominantly gay men's disease. That's the reality. So when we're talking about heterosexuals in Australia being affected, and you're right, this might go worldwide. So, and I think in other areas, you would probably find if we were talking about this in a American context even, but predominantly in African context, you would see the flip, where it's an 80% heterosexual disease and very little would focus, for a lot of reasons, on same-sex attracted males or same-sex attracted people. But in Australia, it is still, even though we have a great kind of control of the disease, it's still 90% affects gay men or men who have sex with men. So to all of a sudden be putting out all this information going, hey, heterosexual women, take PrEP, it's actually not needed unless you sit in a kind of another area within there. Maybe you're from an Aboriginal Torres Strait Islander population. There's also an injecting drug use history, something like that. That's when we probably should and ought to be talking about, I don't like shoulds, but we ought to be talking about where that type of an intervention, where PrEP could be effective in a heterosexual context.
Yeah, thank you so much. No, I've always wanted to ask that question, and now I feel, because I didn't understand it, but you've made it quite clear. In your role as an LGBTI service manager, like, what are some of the things that you're noticing the community are facing in 2020, 2021? What are some of the new things they're facing, or what are some of the things that are really highlighted?
I know it sounds so boring to go COVID, but you can't talk about 2020 and what any human being is facing without mentioning COVID. And for our communities, there's some very unique connections with that, with LGBTI communities, because you're already talking about a highly marginalized, highly sometimes isolated, and I don't mean isolated like regional rural, which we are, but also isolated within our own homes. Some people very uncomfortable with being out and doing that in public, things like that, who are now literally having to stay home. There was a question about sex during that period. Should you be having sex with anyone? Should you take a break from your PrEP if you're not having sex? So those things really came up for us with COVID. But then I also think what I started with at the beginning, I think what we're seeing in the last couple of years, and I say that, 18, 19, 20, 21, those years, is this move away from us thinking about LGBTI health in an HIV disease modality framework.
Is it more like moving into mental health, do you think?
Mental health. So, this whole holistic approach to health, what I call the plus to health, aging, mental health, community and community connectedness and how that relates to health, housing and how that relates to health. You don't know very many people taking great care of their health who are living on the street like that, So all of those connectors, but then also when it comes down to our general, what you call the more clinical health, transgender, diverse, and non-binary health is a huge thing right now, because as generations have moved on, this idea of being gay or lesbian does not hold. I want to be more fluid, and so as I'm fluid in that space, my needs change, my health needs change, and what are organizations like QC doing to meet that need? And when you look at that and you think of people transitioning, so maybe someone who's actually decided they want to go through that, there's a whole slew of issues around what estrogen or testosterone have on your body for long-term effects with bones and all of that kind of stuff. And of course, for same-sex attracted women, cervical cancer, smoking, the things that have kind of sat in the backdrop of HIV, alcohol, and other drugs. Huge issue for our community. So we have a lot of other things we need to look at without diminishing and without saying that HIV is no longer an issue, because it still is.
Yeah, I mean, like before we move on to the next one, with the COVID thing and addictions, I've noticed that the people I've been interviewing have been sort of saying the same thing. Like, again, me being naive, I thought everyone's in lockdown, there'll be no drug use, right? But
Oh,
but I
no.
know. So how are you
It's like the
managing?
rainy day thing. Oh, it's raining out. I can't leave the house. I'm get on. So
Yeah,
that's what's
how are you managing that? Like, how are you managing these sort of, I guess, things that aren't really exposed or out in the open? Like, do you have? Are you doing outreach or something like that?
Yeah, well, what we do firstly in that kind of sense, whenever you're talking about the more stigmatized um, practices within our community, the first thing we have to do is not do anything to add to shame, guilt, or blame, because we know, and this is why fear-based campaigns do not work. And everyone, particularly heterosexuals, will remember in Australia the Grim Reaper campaign, terrible campaign, because all it did was scare people. When you scare people, you push them into the closet and they don't come out and say, hey, I'm at risk of this, because there's so much fear around it already. So what we do is say, it's okay. It's okay to talk to us about the fact that during COVID, your alcohol use went up, your recreational drug use went up, and that now you're actually concerned that you might have a problem because of that. Because
Right.
there was who wouldn't want to escape from the world in which we are operating in right now? And the normal escapes were going out to a club or maybe a night out with your mates. When that kind of escape was taken away, which is what COVID did, people then tried to do that within their own homes, and some of those people have found themselves facing a bit more of an issue than they thought. So we just make sure that we're open, non-judgmental, and that we're willing to have that conversation and meet a person where they're at. For some people, it's been great. They were like, "Woohoo! I've tapped into all of this wonderful pleasure through, drugs and enhancement." And for some, it's been, "I absolutely need to stop and I need to talk to it." So we will meet people where they're at on the spectrum. We don't push them to any point on that spectrum.
Okay. I mean, I interviewed Albert Kruger, the president of Mardi Gras, and he was talking about what you were saying earlier about, trans and different communities, and how the communities are still not forging a synchronicity. There still seems to be a separation. What is your take, or what do you see as a step that we can start to integrate our community rather than being separate? Like, what do you think?
I take his point, but I'll say this:
It's a
that
big question, really, isn't it?
it is. It's huge, and you know what? It's historical.
Yeah.
When the gay rights movement and Stonewall, when we only talked about gay, and gay meant lesbian, gay meant everything. There was an issue between cis gay men and cis female lesbians. You know what I mean? Like people who identified as a little bit like, we can never get along. Oh my God, it's this full kind of thing. So that has been a bugaboo for our communities since day dot. And I think we have done remarkably well in managing that. And I think we're doing that now. What I am no longer, and you are not either, honey, so welcome to the world, the face of LGBTI community. We're like kind of white, straight people in America. We're kind of like, ooh, gay white dudes. You know what I mean? Like, oh, hold on a second. That's like the privileged people. And there's truth to that. There's absolute truth to that. So we have to look at ourselves and find out where we fit in that and where we're going to work to make, again, that unwelcoming space. It's not up to the trans person to teach me about pronouns.
Mm.
It's up to me as a part of this community to learn about pronouns, to understand why that is important if I want to be a part of this wonderful community that we are.
Yeah.
And I think there's a lot of really exciting things. I will not profess to know them. I'm 50. I was, hey girl, gay dude for a long, long time. So for me now to kind of go, oh, you prefer to be referred to as they, them, and theirs. Uh, why? It doesn't actually matter why. That's
Mm.
just where they're at. And there's some cool stuff in that. So I don't want to be referred to as an individual. I want to be referred to as they and them, which means more. And it means it's encompassed. So there's some great stuff in it. It depends on how I want to come at it.
Yeah.
Yeah. Do I want to see it as, special rights or whatever? Or do I want to go, wow, that's really cool.
Yeah.
That's really cool. I don't want to be defined by my gender, by whether
Yeah.
or not I have a vagina or a penis.
Mm.
I want to be defined by who I am as a human being.
Mm. I mean,
Cool.
the secret men's business, all the staff and the volunteers, we actually finished training on trans, and it was
Yeah,
I learned so much. Like, it was really good, and it's actually free and it's online. So I
yeah.
actually may post it to this podcast link so
Dude,
people can do it.
I really
Um,
want to learn, and I think it's great when people want to learn. Let's keep learning. Let's keep growing as a community.
yeah, I mean, when we were talking on email, you were mentioning something about resilience.
Mhm.
So going on with this topic, it's like, what are some of the things that we need to do to become more resilient
I
as
mean,
gay
hey,
men or LGBTQIs?
look, I just think resilience is probably the word of the year. I mean, we all are actually acting within our resilience right now. Putting on a mask, dealing with being isolated at home, um, finding ways to connect, even what we're doing here, this Zoom. So
Mm,
we're being resilient. We're building on our own strengths, and we're helping others to connect with theirs. And I think that's so important. One of the terms that I have despised that's come out of this whole COVID thing is socially distance. We don't need to socially distance. We need to physically distance. We need
mm,
to socially connect more than ever, but in physically distanced ways.
mm.
Yeah. So I would love to challenge that. And I would love if anybody takes anything out of this today to stop saying social distancing and say physical distancing, because if we've ever needed to be more connected socially, it's now. It's just the ways we're doing it need to change. So we need to do it like this. We
Yeah,
need to do it sitting 2 meters across from each other or whatever it is. But we need social connection more than ever, more than
yeah,
ever. And so those are things that are about resilience, because we're in just a world of change and flux right now, and that demands of us to be adaptive and resilient and to learn, keep putting things into our toolboxes.
mm,
We don't not need to pull it out of that toolbox now, but we will at some point, and that's resilience. When
yeah.
instead of just blowing your wig and losing it, you reach into that toolbox and go, "That's right. I've dealt with this before. I've got some tools in my back pocket I can use to help me get through this and feel better."
Mm. I mean, you're so passionate, aren't you? Like, I've never seen you like this before. I mean, like, I think I've seen you, like, socially, but this is your work stuff. So, what is it about this work? Because you've been doing
Uh,
it a long time that you love. Why do you love this work when you can do anything?
because it's talk about privilege. I mean, this is an honor. I get to work every single day to better, hopefully better, and improve the lives of people just like me, or people who are part of my wonderful community. I mean, how grateful, how blessed, how lucky am I?
Mm.
So I was just unwell for a few weeks, and I had time off of work, and I could not wait to get back to work on the Monday. How many people can say that? I mean, legit, me going to the office, knowing I have 200 emails, knowing there's 2 weeks of stuff that haven't been done, and me going, wow, how great is it that I get to go in and do this? Because what I do is easy to see where it makes a difference.
Yeah, but
Yeah.
it's also the passion's there. So I think the passion is the thing that drives you.
Oh,
So
my
I,
mom raised me as a Wally welfare. You know what I mean? I have this wonderful mother who's German, and so growing up in Michigan with a mother with an accent was very odd and also really cool. So it gave me a sense of a broader world, a world outside of my Midwestern upbringing, and it helped me to go, wow, there's different people out there, and that's a good thing. That's cool. And You know, you're right. I have 2 degrees. I have a lot of experience behind me, and I could probably do a lot of different things with that in terms of more money or oh, I don't know, status, whatever that means. But wow, I get to make a difference in people's lives, and I get to help it so people like me, a generation from now, will have an easier go at life.
Yeah, that's cool. I mean, like,
Cool.
have you experienced any obstacles on the way? Like, I'm sure that the most common ones would be like governments or stuff like that. But have there been any obstacles, or do you feel that you've been quite open to the transition and just gone with it patiently and let it evolve on its own? Because you've seen a big chunk of it, haven't you?
It's just, oh my God. Well, yeah. I mean, when I first started in this work, people with HIV were taking 10 to 15 pills a day. And that was, and having treatment breaks so that they
Mm,
would wear out the number of options left to them. And now people without HIV are taking a pill a day to keep from I mean, it could not be any different. And also where our community has gone, we've got gay marriage, my God, we've got all of these things that have happened. But at the same time, we also have a shift towards a populist sort of right wing thinking in some countries, particularly in my home country, and how that balances. So it has not been easy. At times, it has been a fight. There's been people, and in the meantime, many of us who live daily with this disease, I've lost some of those people. They're gone. Some of my best mentors still have died from complications of this disease and things like that. So um, that's been interesting to deal
mm,
with that. But government and anytime you're trying to make change within government, what I've learned is, and this isn't to be flippant towards any funding bodies because I understand it, but you're spending taxpayers' money. It's
mm.
public expenditure, and so it's show me the money. Show me the benefit. I'm giving you $1. What do we get out of that? And we can clearly show in so many areas of the work that we do with LGBTI communities that $1 saves you 50.
Yeah.
And it's just whether or not the government is willing to set morals aside, moralistic arguments, social arguments out of the way, and make this about health and the social determinants of health. That makes the difference. And too often, not so much in Australia, a little bit more so, scarily, it's getting worse, I think. Too often in places like America, you see our health, our community's health looked at as a moral thing. There's nothing to do with morals. It has to do with health.
Yeah.
And
Is it
so
interesting? I would have thought that it would have got easier as time went on, but you've just made it
come around.
because I've noticed when I would volunteer, it really everything changed when the government changed. Like I don't want to like again put any emphasis on a particular government, but if one particular government was in power, we'd get more funding, and it's like, oh wow, that's unusual. And I thought that that would have evolved and changed, but it sounds like it's still political, isn't it?
It is, and it depends on the state. I mean, you look at New South Wales here in Australia, and they've had a Liberal government for some time now, which tends to lean more conservative. Not always. They've seen, increases in their funding. Places like ACON, they have a great relationship. Queensland, quack. Our old acronym for the Queensland Council was famously defunded by the Newman government because they weren't going to do gay health. So, and now we've had a Labour government for 8 years, luckily just reelected for another 4, who sees it very differently and can take that moralistic side out of it and look at it as a health need. And so that's just the way we work. Look at America. Look
Yeah.
at what happens in America. Going from 8 years of Obama Biden to a Trump Pence, I can tell you, community organizations there that deal with our communities are struggling. They're not
Yeah.
getting any help from the
Well,
federal.
I can't believe that they've got to pay for their own medication there as well. So like, how did the guys
Yeah, you're right. And you know what? A lot of places don't, and that's what I'm trying to say. Like the federal government, had the Ryan White Act. There were a lot of things that were set aside that would help people who couldn't pay or didn't have insurance to pay. That stuff's been cut, and it's been cut because of moral value judgments, not
Oh,
because of smart health determinants.
yeah.
And look at how responses to COVID, and you realize how simple that would be for to happen to us if it's happening to mom and pa who don't have to wear masks because that's
Yeah.
right.
Okay.
Yeah.
I mean, so one last question, I guess, and I guess what would be your message to the LGBTI community about mental health? moving forward? Like, what would you want to share with our listeners about what you feel is an opportunity for them to start to embrace change, or even a process?
Yeah. There was a wonderful campaign done not so long ago, I think in Australia, that it did come out of the marriage equality kind of discussion, if you want to call it that, because there was a lot of really hateful, hurtful things being said in public about our communities by people who knew nothing about them. And it was all about, you'll be okay, you'll be right, and just ask for help. Help is here. If you're young and you're coming to terms with your sexuality or gender identity or any of those types of things, you are not alone. We have been there, others have been there, and it's okay to ask for help. It's okay to say, I'm struggling. And we have organizations all over this great country and indeed across the world who exist for the sole purpose of making sure you are okay.
Yeah.
And so we can only do what we do if people come forward. And hey, why not? What kind of fun? Come forward, talk.
Yeah.
You know what I mean? Like, we're not going to hurt you. It's going to be cool.
Yeah. Lance, thank you so much for spending your afternoon with us. And I really appreciate your time and you've taught me a lot of stuff. So thank you.
You're welcome, Joe. Thanks for having me. Thanks, everyone.
It's okay. You've been listening to the Secret Men's Business podcast. The podcast is out on Mondays and Thursdays. Now, don't forget, hit the subscribe button so you're told when a new episode's out. And we'll be seeing you soon, guys. Have a great week. Bye.